working now?
I work for Partners Hospice.
Okay. And when you look back over the last several years, just prior to getting involved with the task force, where were you working?
I was working at Brigham and Women's Hospital.
Okay. And what was going on at the point that led you to get involved, as you were getting involved with the task force? What were you finding was happening with you?
I was working at Brigham and Women's Hospital. We had a really sort of huge indoor air quality, latex allergy, chemical exposure issue with the nurses at Brigham and Women's Hospital. That was prior to having an occupational health and safety program here at M&A. So that was sort of the the impetus that started us being concerned about health and safety issues and realizing that as an organization it was time for us to start to address this on a more formal basis at M&A. Okay. So initially when the nurses at the Brigham got sick, we came to M&A and they provided us with resources and to start to address what was happening there specifically. But from that we took the issue and came to convention and started to try to get a formal occupational health program and to hire somebody who could be there to really more formalize a health and safety program at M&A to address a lot of issues that we were just starting to realize were affecting people in the healthcare industry.
So you kind of had two big things on your plate at the time. How do we repair what's happening in our place of work?
Right.
How do we create a resource that will be available to us from here on out?
Right.
Okay. And how quickly did that all come together for you guys? What kind of improvements? What kind of what did you do in your building, and how did everything evolve here?
Well, the issue at the Brigham was huge. I mean, there were hundreds of employees who were very sick, hundreds and hundreds of nurses who were affected, either by latex allergy or chemical sensitivity, occupational asthma, and there were over 100 nurses who had to leave the hospital and not return. So that was sort of the initial impetus, and I was one of those nurses who couldn't go back to the work environment. But I was the chair of the bargaining unit at the time, so I was very involved at, locally and at the state level. And a group of us got together and started to have meetings here at M&A that sort of led to us going to convention and starting to look for a more permanent program that would start to address nurses' health and safety issues.
Now, when you realized that you were also one of these nurses that was getting sick, what was happening with you physically, and was it exactly what was happening to the nurse next to you?
There were a lot of variations in what was happening to the nurses. Some nurses developed asthma, some nurses developed chemical sensitivity, some people had very severe latex allergies, so it was very difficult to really understand what was happening. And there wasn't a whole lot of information out there at the time. So the work that we did at the Brigham and through the M&A was something that really was brought to nurses across the country, and we really found out as we went national that there were nurses all over the country who were experiencing many of these same problems. So I think the latex issue really was a big part of that for nurses all over the country as they were being exposed to latex and starting to develop problems.
Now, as you were getting more involved with your coworkers on this issue, and as you were getting more involved with the M&A, what kind of changes could you see being implemented as you brought information back to your hospital? What things started to change once you were able to make improvements?
I had left work by the time I understood that I was sick. I was out of work, but I was still the chair of the bargaining unit. I was still attending programs, meetings at the hospital to address what was happening with the nurses and what was happening with the environment. And so we were working on modifications that they needed to make, and they went through the building and they modified the ventilation system, and they eliminated latex gloves, and they looked to replace any chemicals that were causing people problems with alternatives. They really, at the time, we didn't believe that they were doing enough because we wanted immediate solutions, and most of us that were sick wanted to go back to work. Yeah. and we found that we couldn't do that. But the hospital, over a period of time, really completely redid the environment and addressed all of the issues, for the most part, that were causing people problems, so that new people didn't get sick. Some people that got sick were able to go back, but not all of them.
Yeah. So it was a really a deep change in the way people were living their professional lives.
Right.
That affected, and this was happening across the country.
It was.
Okay.
Yeah.
At what point did you become aware that this was not, you weren't the exception, you were the norm?
Well, we went to the American Nurses Convention, and we spoke at the convention. We wanted to bring this issue to the attention of nurses on a national basis and start to get the ANA to increase their health and safety program as well. So, and when we went to convention and we started to talk to nurses from all over the country who were having similar problems, or knew other nurses who were, and as we started to, we were a group of nurses who got sick at the Brigham initially, and then Kathy Dicker from Falmouth, she actually started to come and meet with us because she was sick herself, and we started to do research, and we met with people all over the place, and you know, M&A was really a great resource for us at the time, and we were able to start to better understand what was happening to us and what kinds of things needed to be done to prevent it. But the broader issue of nurses and other healthcare worker health and safety was sort of a light bulb went on in our head about, we have really not taken this issue seriously, and it's not something that as a profession we have really addressed well enough in the past, and it's time for us to start to do work and to identify the issues and to make sure that people are healthy in their workplace. Yeah. So that was sort of where we were coming from at the time. But yeah, we were all sick, and we were all trying to, you know, we were communicating with a lot of different groups and trying to make change and trying to understand how to get ourselves better, and we wanted to go back to work. And yeah, there were a lot of issues. People were on workers' comp. They weren't making the, you know, there was the workers' comp system was really a problem, and we were going to a lot of workers' comp hearings to support nurses who were going through their hearings at workers' comp. There was a lot of issues going on simultaneously.
Layered. Issues I'm sure you didn't even imagine you were going to get into.
No, absolutely not. But I was experiencing them firsthand, so I understood how yeah, devastating it was for people to go through it. And people were essentially losing their careers and not being able to go back to the work that they loved, and and that was a really big piece of it for us. Right. So
now you've been involved from the beginning, and when you look back over the last several years, having realized that there wasn't this resource here and seeing what you've become now, what's it like?
You know, sometimes you forget how much has been accomplished over the time. And initially I was on the board of directors, and I wasn't on the Congress on Health and Safety when it was first, when it first came together. But as you look back to see all of the directions that the program has taken, and Evie Bain was just, we were just so fortunate to find somebody like Evie who could sort of take this challenge on and start to utilize, I mean, we're volunteers on the Congress, everybody has another job, and so a lot of people come together with their expertise or the issues that interest them that brought them to the Congress in the first place. But Evie is the one who's like the conductor, who's, you know, taking advantage of people who want to do something and sort of showing them how to do it, and collaborating with groups all over not just in Massachusetts, but across the country. And so it's really amazing to see all that's come out of the Congress on Health and Safety and the program here at M&A. They're just very well respected nationally and even internationally now, and we've done some really, really great work. And I'm really proud that we've come this far. It's really amazing.